Studies suggest that about 80% of the African population relies on traditional medicine for their basic health needs. This is why the World Health Organization is urging governments to strengthen collaboration between technology and innovation institutions, traditional health practitioners, and the private sector. Health correspondent Kemi Balogun has more.
Traditional medicines make use of natural products and are of great importance. For over hundreds of years, this practice has blossomed into an orderly, regulated system of medicine. Traditional medicine is now seen as a trusted, acceptable, affordable, and accessible source of healthcare for African populations. It has contributed to traditional medicine-based therapeutics for priority diseases such as HIV and AIDS, malaria, diabetes, hypertension, sickle cell disease, and now COVID-19.
It is pertinent to recognize and appreciate efforts made by our herbal practitioners and researchers in the development of local herbal remedies for the management of various ailments, particularly COVID-19 related symptoms, which forced several countries around the globe to look inwards for the search of new herbal remedies.
All we need is history of use. If you've been using it, if it's been used in your family, or you have evidence that somebody has been using it, we will register it for you. Once your product is registered, it is not a license to advertise. So if you need to advertise, you also need to let us know, and we will give the approval for the advert.
Here in Nigeria, God is already blessing Nigeria in traditional medicine practitioner. No need to carry yourself, go another country. The medicine day here in Nigeria.
This year's theme of the African Traditional Medicine Day is 2 decades of African traditional medicine, progress towards achieving universal health coverage in Africa. Presently, the World Health Organization is supporting joint missions with partners to some African countries like Nigeria to monitor clinical trials of traditional medicine-based therapeutics proposed for COVID-19.
In the progress report on the implementation of traditional medicine strategy in Africa is also recognized. Nigeria is recognized there. There were submissions from Nigeria to the Regional Expert Committee for the products developed as therapeutics for COVID-19, and the submissions are under review.
More than 40 African countries are now developing national traditional medicine in national health system policies by 2022, rising from only 8 countries in 2000. Kemi Balogun, TVC News, Abuja.